Hello, good evening. My name is Dr. Pede Ufondo of Snowspirations Global Health Solutions. Thank you and welcome to Open Clinic with Dr. Trudy on YouTube. Today we're going to talk about VBAC. So VBAC stands for vaginal birth after cesarean section. Is it possible for you to have your subsequent pregnancies through the vagina if you have had cesarean section in the past? Very important topic. Very important question that so many of our members are asking. So if you're currently pregnant, probably in the past, you had your baby and you had your baby through CS, and you're wondering, I don't want to go through CS again. I want to feel vaginal birth. Is it possible? How many times can I have a baby and still have the possibility of having vaginal birth? These are genuine concerns for so many pregnant women. But guess what? The common denominator when you're pregnant is your baby. Whatever method that will give your baby good outcome, that's what we go for. So it's not all women that can go for vaginal delivery. It's not all women that might have a need to go to CS. But guess what? Whatever you decide, it might not be the best for you. The best for you will be based on what your doctor will tell you. So delivery is customized. So just make yourself visible when you join. Introduce yourself. Tell us who you are. And as soon as I have a good number, I'm going to start my presentation. So I plan to give my presentation. Afterwards, you can have an opportunity to ask your questions. If today is the first day attending my clinic in YouTube, thank you and welcome. My clinic in YouTube is on Tuesdays, just about this time, 6:30 p.m. Eastern Time, US, 11:30 p.m. Nigerian time. Immediately after this clinic, I will run another clinic in in Facebook. Our Facebook, it's going to be exactly this topic. We'll try and understand vaginal birth after CS. You will have opportunity to share your concerns. I will also share the advantages, some risk factors, some worries, some disadvantages. Then at the end of the day, you will be better informed to make the best decision for you and your baby. So I'm going to start. When you come in, just join and share this video. And please make sure you click on the notification. Make sure you subscribe. Make sure you watch other important videos in our channel. So before now, when a woman has CS, subsequent deliveries are all kept on the CS level. So what do I mean? Depending on the reason why you had CS, there are so many reasons. Your second pregnancies before now will be planned towards CS. So previously, such women, once we section you, will continue to section you. However, with modern technologies, with modern day practice of medicine, it's possible to have vaginal delivery when you've had CS. So it's no longer constant that once you have CS, all your babies are going to be CS. Some women might still have vaginal delivery. The reason why in the past we only want to go through the route of CS is precautionary measures. But CS is also a major surgery. So if we have to avoid it, we have to avoid it. So in modern approach to delivery, vaginal delivery after CS, which we call VBAC, it's considered a safe option for some women and their babies. Not all women, some women. In our group, we do not condone, we do not suggest, we do not recommend more than 3 CS. 3 CS is our cutoff point. Once we have opened your womb, you are counted as having CS. So a woman that had myomectomy is considered a woman that had CS delivery. Please, once you've reached 3, in our own group, we don't encourage 4 CS up. We want to have you alive. We want to have you with all the abilities to take care of your babies. But there are so many women out there that are good candidates for VBAC. But the choice is too tough. It's a choice you have to make with a lot of informed decision. So why will you consider VBAC? So anytime I mention VBAC, remember it stands for vaginal birth after CS. Now, compared to having CS, when you have vaginal delivery, there is no surgery. And when you don't have surgery, there is no need for complications, because anytime you go for surgeries, there are possibilities you might have complications. Now, when you go through vaginal delivery, your stay in the hospital is going to be shorter. You will return quickly to normal daily activities. Now, VBAC might be also appealing if you want to feel vaginal delivery. There are some women that say, oh, I want to feel the way vaginal delivery goes. If you're a good candidate, your provider will recommend that. If you're not, we'll go through CS. Now, it's important to consider the future pregnancies. If you plan to have more pregnancies in the future, VBAC might necessarily be your best option if you are qualified. It's not everybody that will qualify for VBAC. Remember, VBAC stands for vaginal birth after delivery. Having your baby through the vagina if you have had CS delivery in the past. So if you're planning for more pregnancies, VBAC will help you to avoid multiple cesarean deliveries, which will come with complications like placental complications. Now, what is the difference? How does labor and delivery for a woman that is going through VBAC differ from a woman that is just having her normal vaginal delivery? They will pretty much be the same. However, based on the fact you've had vaginal delivery in the past, we will monitor you and your baby closely, especially the baby's heart. The heartbeat of the baby can tell us if the baby is compromised. So if we are waiting for you to go into trial of labor and somehow we check the baby and the baby is compromised, the heartbeat is dropping, which is bradycardia, we're going to go immediately and deliver you. So it's going to be a close monitoring, but the difference is not going to be much. Now, what other advice do we offer women considering VBAC? We have to allow you to share your concerns. We have to allow you to share your expectations. But please, make sure if you are considering VBAC, we have to have comprehensive medical history. So we have to have all your medical history, all your gynecological history, all your surgical history, whether you've had appendix, whether you have myomectomy, whether you have polypectomy, whether you've gone for evacuation. We have to have all those full history. Anything that has happened to you in the past, we must know. Your history of infections, because they will help us to know the best approach. So we have to calculate your likelihood of having a successful VBAC together with the likelihood of having risk factors and complications. Once the likelihood of having good outcome is better than the complications, we will advise you to go further. Now, whatever happens, you must make sure that you're in a facility that if anything happens, we can take you in for emergency CS. It's not always good to go for emergency CS. CS is better planned. That's elective CS. We give you a date, we come in, we bring out your baby, you're good to go. Anytime we have emergency CS, is a salvation mission, because if we don't do that emergency CS, the life of the woman might be in danger, the life of the baby might be in danger. So you have to continue to discuss the risk factors and the benefit of VBAC with your provider. Above all, you have to be flexible. So once things change, any woman can deliver through any method. Your baby might be doing fine, and suddenly we can take you to the theater. So during delivery, once you're due, we are going to take maximum precautionary measure to save the baby. So if we have to go for CS, we have to go for CS. So you have to make sure that the hospital where you register to deliver, they have adequate, well-furnished theater, which you can take you to deliver your baby immediately. So if any of the circumstances surrounding the labor ends up having you to go for CS, we're going to do that. Now, what are the risk factors involved with VBAC? Remember, VBAC stands for vaginal birth after CS. Now, fewer complications. But the biggest risk factor which we worry about in VBAC is possibility of wound rupture. When your womb ruptures, your womb is gonna tear, like, divide, and your baby can escape. And it's a deadly thing to happen to anybody. You can actually die instantly because there will be a lot of bleeding and all that. So that's the biggest rare complication and risk factor that might happen in women that go for repeat vaginal delivery when they've had CS. It's life-threatening. It might be rare, but we have to check all the boxes. When you have uterine rupture, this place we had the previous CS will be ruptured, will open. And when that happens, it's an emergency. Once that happens, we must take you to the theater. In some situations, we might cut off the whole of your womb. Now, who is eligible for VBAC? So who are the women qualified to go for vaginal birth when they've had previous cesarean section? We have to know the type of CS you had. The prior CS you had, we have to know the incision. Is it vertical incision? Is it longitudinal incision? If you had previous low transverse incision, it's encouraging. So if we have minimal cuts on the transverse lane of your lower belly, you are a good candidate. So women that had low transverse, low vertical incision are usually good candidates for VBAC. But if you had a classical vertical incision, vertical classical incision, it's not recommended for VBAC. There is a lot of danger. Now, if you have had uterine rupture in the past, you cannot go for VBAC. Matter of fact, your pregnancy is very, very risky. So if you have had other surgeries in the past, we might not consider you to go for VBAC. So if you've had myomectomy, polypectomy, procedures done in the womb, you might not be a good candidate for VBAC. So if you've had previous surgeries in the past, we have to be careful. Now, if you have had previous successful vaginal delivery, that might be an advantage. So a vaginal delivery at least once before or prior to the prior CS will increase the probability of successful VBAC. So if you have had one baby in the past through the vagina, then the second baby through CS, the third baby can be through vagina or CS. So it improves your odds, your chances. Now, if you have had many CS in the past, your chances of going to VBAC will be limited. Many healthcare providers will not offer you VBAC if you have had more than 2 previous CS. They will proceed with CS. Why are we doing this? We don't want to take chances. Now, also when you gave birth last, normally in our group, we recommend allowing 18 months after delivery to become pregnant so you can recover. So if you quickly become pregnant after 3 months of having CS or 6 months after having CS, definitely we are going to section you. So if you allow about 24 months to pass before you become pregnant again, your wound would have completely healed, your wound will be fine, and you might be a good candidate. So how soon you become pregnant after having a previous baby will limit your chances. If you have any health problems, hypertension, diabetes, some infections, we might be safer going for CS. A CS will be recommended if you have placenta problems in the past, if you had previous history of miscarriages, if you had previous histories of stillbirth, we might just play it safe and go for CS. Now, where your baby was delivered, it's important you go to a tertiary center. Tertiary center like teaching hospital. Don't go to a cottage hospital. Don't go to that doctor that claims to be whatever he's not. Make sure you register for your ANC in a teaching hospital. Anytime you've been sectioned, please register under a tertiary center where a senior doctor can monitor and make sure that things are going okay. Plan to deliver in a facility that can handle emergency CS. There are some women that will go to some hospital. By the time they start referring you and moving from here to there, looking for who to transport you, your life might be in danger. This is the reason some women will die during delivery. No woman should die from delivery in 2023. Now, if you also have a need to be induced, you might not be a candidate for vaginal birth. You might just be a candidate for going for CS. So that's my presentation this evening. Now, I'm going to give you an opportunity to ask your questions. I can see it's only me and COO in the clinic this evening. So COO, thank you so much. At this juncture, let's interact. So hit me with some questions. I'll provide you feedbacks. So COO, thank you so much. Go ahead. Thank you, my amazing COO, amazing lady. So let's have a chat. So hit me up. Very important topic for our community. Very, very important. If you're currently pregnant and you didn't attend this event, I don't know what else you're doing. Okay, what about if the baby is big? Correct. So that's why we have to, check the totality of the indices. So what will actually determine the method, the day, the timing of delivering a baby is actually the baby. The passenger and the vehicle and the doctors will determine the outcome of your pregnancy. So if you're gonna have a big baby, which we call microsomia, so there are so many criteria for checking babies. So when you carry your baby inside your belly, there are ultrasounds we can use to estimate the weight of the baby. If you're carrying a big baby, possibility you're not gonna go through VBAC is very high. So possibility you're gonna go through CS is higher than going through VBAC. So big baby, women that have big baby, anticipated big babies will definitely go through CS. We are not going to take them through trial of labor. Anything that will compromise the transit time of the baby from the womb, we don't want to encourage that. So once your baby is delayed in delivery, your baby can be compromised. Your baby can have birth defects. Your baby can have injuries, which can affect the brain and all that. Your baby can have a lot of complications. So once that time the baby wants to come, the baby must come. Once you're in labor or we induce you, we must deliver the baby. This is why we don't allow any woman to go beyond 42 weeks. So you see all those women that will come and say, oh, I've been carrying my baby for 2 years. It's not true. There is no pregnant woman a good doctor will allow to go beyond 42 weeks. We must bring that baby out by all means necessary and all means legal, okay? What if labor was induced? Is VBAC done for induced labor? No. If a woman has a need to be induced, we are not going to induce her in previous scar. We are going to straight on, assess and prefer CS. So a woman that might have a need for induction of labor, if you don't go into labor naturally, or if labor is arrested, or if labor is obstructed, we are not going to take chances. We are going to go for CS. So a woman that previously had CS, and probably based on her profile, we are considering to go for VBAC, once there is need to go for induction, to go for augmentation, to go for assistance, we're going to section you. We don't want to take chances. I love those questions, CO. So let's keep talking, keep asking me questions, all questions, please. Just keep bringing them up. We're going to round up in 20 minutes, so we can go to Facebook and round up. Okay? Keep asking your questions. Remember, the month of May is going to be May of miracles. So brace up for miracles, brace up for multiple blessings, favor, income, whatever you want from God, God is going to give you multiples. So be on the lookout for the topic for May. After the first VBAC, is there a higher or lower likelihood for subsequent one? Of course, lower likelihood. Remember, in our group COO, we don't encourage more than 3 CS deliveries. So if a woman had her first baby, vaginal delivery, then maybe she developed preeclampsia, hypertension emergency in pregnancy, we go for CS. Now, if she observes 24 months before becoming pregnant, her womb is fully recovered, every indices is telling us she can go for VBAC. If we give her VBAC, that will be her third pregnancy. The fourth pregnancy will be riskier. So the more you deliver, the more you put the womb into any pressure from delivery, the more the possibility of having more babies with risk factors will be higher. So subsequent delivery let me give you an example. You've had one VBAC. Possibility you'll have the second VBAC is limited. So after one successful VBAC, the subsequent delivery, if you become pregnant, will likely be through CS. Very, very important. Remember, the general aim of pregnancy is to deliver the mother and the baby, both of them are alive. We don't want to take chances. I love that question, COO. I don't know where you're getting your questions. You're confusing me sometimes. Sometimes it feels like we are having, like debriefing between colleagues. Such a very amazing, knowledgeable, smart COO we have. Okay, guys, thank you so much. And we're going to transition to our Facebook. If you missed this clinic, I'm telling you the truth, you missed a lot. 20 minutes of amazing. So today we talked about VBAC, vaginal birth after having previous CS. And I'm telling us that with the modern technologies, with the modern interventional policies, so many women will be qualified to go for vaginal birth after having previous CS. But there are so many things we need to factor in: your medical history, your surgical history, your gynecological history, your infectious history, everything about you we have to factor in before we can say, okay, let's go for VBAC. So please consult with your doctor. Make sure you share all the relevant histories before we can arrive at the best option for you. Every pregnancy and every baby is customized. The only option we will take is the option that will favor the baby and the mother. Sometimes you might not like it, but we don't care. We care about your health. We care about the health of your baby. So enjoy your evening. And please, if you're in our Facebook, quickly join me in Facebook and we continue the conversation. COO, thank you so much for those beautiful questions. I'll see you in Facebook. Bye-bye for now.